Happy for what? Happy for the knowledge gained and happy for having all of us together today, and especially that we go out and go from here with the message that every child must be respected. So I'm very happy actually. Incidentally, this is my 25th year of standing in public talking about autism, which I started way back in 2000. And I must thank the organizers, Aiims, Dr. Jaishankar and his team for giving me this invitation and the opportunity to speak to you all. I can see that you have heard such wonderful lectures. You have heard so much of advancement that has taken place. But I'm going to bring you back to reality of what initiated the spark of autism in me. And with that ethos, I will take you through my journey, and I hope a few points can be picked up from there so that you can continue this journey further. How it all began. Being a pediatrician, I was following up a child. At 18 months of age, I lost her for follow-up because the last 18 months injection was given. That was the DPT booster. And thereafter, I lost her. But then, one day she came running to my chamber, standing on my table. And I said, oh my, what's this? The autism word came into my mind. And surprisingly, actually, I knew nothing of autism, but autism came into my mind. I sent her, I said, I will not be able to manage you, like all of us probably has said. And then I sent her to an Aiims. The story still goes on till today. And then she came back with the diagnosis of autism. Then what? I didn't know what to do with it. But the whole autism, the concern for autism actually rose from a response to this mother who says, I want my child to call me Ma. I froze literally because I could not hear Ma from my children, and my patient across cannot hear. Then there was another patient. She came, she has been going to many professionals. Then she came and she said, at last there is somebody who knows what my child is having. So these two words, at last, it's that relief. You know, these two words touched my heart so much that I decided that I should work for them. But work on what? Work on allaying anxiety for the parent. That was all. Because I took up this daunting task, understanding that these two children who I have seen are not mentally retarded. It's not intellectual disability. And I had no guts in my heart to send them to a rehabilitation center which deals with intellectual disability because I knew they were intelligent. So this is how the journey started. I had a lot of challenges because first of all, I had no reference to what is autism. No reference at all. In Nelson, in the 13th edition, autism was considered as a case of psychosis. In the 17th edition, it went up to pervasive development disorder. So I said, no, but this child is not psychotic. My child, because I was looking after this child, and I said it cannot be psychosis. So now, what were the challenges that I came across? Number one was no clear definition of autism. Next is, whom does autism belong? Does it belong to a pediatrician? Does it belong to a psychiatrist? Does it belong to a psychologist? Does it belong to a speech therapist? Does it belong to an occupational therapist? Whom does it belong? There has to be a person who's going to orchestrate the whole management. So this was what I was saying. Then I saw so many people were doctor shopping. They go, even after I see them, they go to some neurologist, they will go psychologist, they will go to psychiatrist, and that was a challenge for me. Why are they not listening to me? Have I not been able to impress them? Have I not been able to give them? But then I did not know the cause of autism, and I was unsure of the prognosis because they wanted kotha patibo, kithe kotha patibo. If we help him, kithe kotha patibo. I did not know how to give the answer. So, and then I found that the parents were so distressed because the family and the society did not accept them. So this was, all these are the issues that actually I needed to solve, but I had no one around me at that time. So what I did, I had to leave the comforts of my home now, and I went out to educate myself. And fortunately enough, 17th, 18th May 2000 in New Delhi, I met Professor Joaquin Fontes. He is a Spanish child psychiatrist. And then I met Dr. Gillian Bird in 2000 in CMC Vellore, who was a pediatrician. So now I could put two things together, a pediatrician and a psychiatrist. Then I went to We Can India organization in Chennai. And then I started understanding the initial structure of how to go about this. So this motivated me that no, the child, these two children that came into my chamber, that I should open up a special needs section of Guwahati Children's Clinic. And that was in 2000. So now I opened the section and I had to devote 2 hours of my clinic time for these children. So as you can see, an assistant and myself, we were working with this child. And fortunately enough, the child was improving. But then there were many answers because I could not answer the parents properly. So what I did was, we had to have introductory parent sessions. That was in 2002, as you can see here. It was a special needs section. With this girl, I started off parents' education. And then we saw that she was developing. By word of mouth, people were coming, but then I was getting tired. It was time consuming. I lost 2 hours of my clinic practice because that was the time I was just 40 years old. And I had, my practice was rising. And then monetarily I had problems. There were staffing issues and then challenges in parental understanding. So I know that this work cannot go on as a clinic practice. Then came 2004. Having understood all the problems, we crystallized into a foundation called Assam Autism Foundation. And some like-minded people came about, and a group of people which I could collect. I know West, as Dr. Deepa Bhaskaran said, the ideal team. I had no ideal team. I think there was one occupational therapist, and probably it was you were there in CRC, Dr. Ramirez, and he was the only one. And then speech therapist. There was paucity of speech therapists. There was educational therapists, but there were no training on autism at that time, because the first training I took here in Manvikas Kendra. So now, what am I going to do? I trained all these people of what I learned, and then I continued on with this work. So, what was the learning curve during that time? From 2000 to 2006, actually I started learning a lot, that more and more children started coming in. Somehow they heard about it and they came. But the age group of entry was 4 to 5 years. And 4 to 5 years, as you have heard, is a very late stage where the developmental age is lost. And hence, this was something that was troubling me. The boys were more than the girls. This was according to what was happening nationwide. But what I saw was every child was different in social, emotional, language, and play. And I did not know what to do, how to categorize, how to give my services. But this gave me an understanding of that how autism is a spectrum disorder. And actually the spectrum nature was given way back in 1960 by Lorna Wing. But then, till 2006, we knew nothing about it. And then the understanding of spectrum came about. So from this group of children, actually, I began to categorizing children. There were children with autism and hyperactivity. There were children with autism and hypoactivity. There were children with autism with high IQ. There was children with autism with low IQ. There was children who have an early start, and there were children who have regressed after normal development. There is again children with double syndromes, and there were children where they are mimics of autism. So this my foundation, actually, my center became a book for me. A book for me, because till today, my last lecture in Pedicon in Hyderabad was on mimics, and this is what I learned from my children. And now, today, the thought process after that means 2000 to 2006, the thought process was about grouping the children, and that has crystallized now in 2026. 25 scientific paper you will get that we are going to talk of subgroups of autism. And this is what Dr. Shefali said, that once you do a genetic study, then we come to know the subgroups, and then we can institute specific treatment. We are now using generalized behavioral treatment, but now we are going to go for specific treatment. So those are the thought processes that actually has already generated in the Northeast. So I just wanted to let you know, and I'm sure all over India actually, because when I was doing this work, I went all over India to meet who are the people who did this work, so that we can know what am I doing. So now, as you see, I have given statistics of 1999 to 2013 here, where there was no services, and this was where I was catering to entire Assam at that time. And we saw that about 55 per year, 50 to 60, 70 were coming every year to us. And we were also addressing Northeast. Then, outside the Northeast. Then we found that the male-female ratio, we were in keeping with the entire world, where the male ratio was much more than the female. And the age group of children was 4 to 5. And interestingly, when I saw the children, it was 4 to 5 years. Thereafter, after sensitization has been done, the age group dropped to 15 months. My youngest was 15 months, 15, 18, 2.5. And then now again I'm getting 4 to 5 years, 8 years, everything. So now this whole story of how the parents are coming back and seeking for help is also telling us a story of how we are managing the children. Okay, then 2007, 2006, after, just 1 minute, after seeing the children's whole pattern